Thousands of medical procedures could be affected when senior doctors strike on Thursday. The Health Minister is urging the union to get back to the negotiating table, but he won't say if he's asked for more money in the budget for doctors' salaries. But there is cash in the kitty for teachers, with the government announcing it will pay for their registrations. Here's senior political correspondent Jenna Lynch.
When all is said and done, politics really is just one big game of winners and losers.
We're in the winning team now, but we used to be in the losing team. And when I was in the losing team, I was in the losing team for 6 years. It's not a good team to be in Parliament. You want to be in the winning team.
The winners of today, teachers, the government fulfilling its promise to pick up the tab for their registration for the next 3 years.
This is a small but meaningful way of acknowledging the incredible hard work that they put in and saying directly to the teaching profession how much we value you. And we thank you for all the extraordinary hard work that you put in each and every day.
Registrations cost about $550, renewed every 3 years. The announcement will cost the government $53 million.
It's quite significant. I have a blended family with 2 adult children living with me and 3 younger children. So in a family budget, $500 last year was significant for us.
The government introduced a policy to pay the fee for those who'd left the profession last year, and it's encouraged 340 teachers to sign back up. This time around, the government's paying for everyone from early childhood through to secondary school.
We do know that it makes a difference. It will encourage more people to come back to the profession, but also relieve some of that financial burden on our amazing teachers.
The sector stoked.
Actually paid mine at the end of last year, so I won't be benefiting personally, but I know a lot of the staff here were really pleased. You could hear and see the reaction when we were told that, so that was a really good bonus, thanks.
It's really important, so we know for our beginning teachers there's a significant cost to them, and also for our relievers and part-time teachers, because there's no part-time teacher council fees, so they have to pay the full amount while they won't be earning a full-time salary.
But on the losing team today, doctors, Health New Zealand not coming to the party with the pay rise they want, so on Thursday it's scalpels down.
We're definitely striking on Thursday.
Health New Zealand's now taking urgent steps to apply for facilitation after the union representing doctors declined to take their latest offer to its members for a vote.
But unfortunately, for most of our members, it's actually less than was initially on the table.
Get back to the negotiating table. This is deeply disappointing. And it's going to mean that thousands of patients are going to have their planned care delayed.
We have only had meaningful engagement from the employer since we announced strike action, and while we're glad that they are now interested in trying to make some moves to resolve this, bluntly they're going to have to put more money on the table.
Health NZ says the offer will see first-year specialists get a 9.5% increase, equating to $17,700, while a second-year specialist would get a 6.2% increase, nearly $12,000. But the union says that doesn't tell the full story.
For most of our members are offering an annual pay increase of less than 1% over a 33-month term, so 0.77% per year for the majority of our members is what they've offered.
The strike action plan will see an estimated 4,300 planned procedures postponed. Health New Zealand said in a statement, "We value our doctors and want to do the best we can for them, but the reality is Health New Zealand has a limited budget available for salary settlements within its tight financial constraints."
Have you asked the Finance Minister whether you can have any more money to resolve this?
What I'm focused on here is saying that the Doctors' Union should put this offer to its members so that thousands of patients do not have their care cancelled.
Have you asked for any more money?
And to get back to the negotiating table. And I understand Health New Zealand is now calling for urgent facilitation with the Doctors' Union to try and address these issues.
Have you asked for any more money?
What we're focused on here is to make sure these discussions are had around the negotiating table.
So, as it stands, with the government unwilling to budge, the ultimate losers of Thursday are patients.
All right, Jenna, does this officially mark the beginning of budget season?
Yes, your favourite season and mine. The countdown to May 22 has begun, the ultimate political game of winners and losers. That $53 million announced today was the first pre-budget announcement. Quite tellingly, the Education Minister would not say whether that was new money added to the education budget or whether it had come from reprioritisations or a government euphemism from cutting other programs. The Finance Minister is set to give a pre-budget speech tomorrow. I'm told in that she will address address the state of the books in light of global economic developments, priorities for investment at the budget, the path to surplus and debt reduction, and the size of the operating allowance. That's the new money that the government gives itself to spend every year. Nicola Willis has committed to keeping under the ceiling of $2.4 billion. But the government's already spent $600 million of that. They had to borrow for their cancer drugs promise after they failed to fund it in last year's budget. So that's quite a tight budget for her to work within. But there are always options when it comes to those reprioritisations, and it would be well placed to keep an eye out for what the government does in that vein, because as we saw today, there are so many competing demands on the government's books.
Yes, we look forward to that speech tomorrow. Jenna Lynch, tēnā koe.